I now get the pleasure of introducing another mentor, friend, and someone who should definitely run for office, although he'll keep getting appointed to other offices by the government, I'm sure, and that is Dr. Dariush Mozaffarian, who helped to provide a bit more context for our conversations around the food as medicine movement. A huge congrats to Dari on his new role at Tufts on food as medicine. He's creating a new cross-university, cross-national collaborative to transform healthcare, a collaborative founded on the Tufts University's traditions of innovation and commitment to public impact. So I want to thank Dari for devoting his life to service. He truly is a hero. Please welcome him to the stage.
Thank you, Danny. So it's such a pleasure to be here. And I think, do I have control? There we go. Thank you. So it's such a pleasure to be here and to see so many new friends, closer old friends that we've had for a long time and sort of allies in this fight. And I want to echo the thanks, and there's been a lot of thanks today, but I really think it's important that we sort of acknowledge all the work that is going into this movement in our country around advancing nutrition, ending hunger, and reducing diet-related chronic diseases. I'm a doctor, I'm a physician, I've been in healthcare my whole career, and there are very few things that I can say the US is sort of leading the way in healthcare system transformation around the world. But food as medicine is truly, truly an American invention and is really leading the way. And we've spread it now into Australia. I had a call with someone in the UK government. This is really an incredible movement. So I really want to thank really important collaborators and leaders who made this happen. So thanks to the Biden-Harris administration for hosting the White House conference. That was an incredibly important moment. And to Ambassador Susan Rice and the Domestic Policy Council, who really made this one of her major priorities, and to her team in the White House, so Catherine Oker and Kellyanne Blazek and Will McEntee and Laura Carroll, who's now back at FDA. They just did an enormous amount of work. Also to the bipartisan support from Congress, particularly Congressman Jim McGovern, who's been talking about this for over a decade. He's really the single most tireless champion around hunger in Congress, but also the late Congresswoman Jackie Walorski, his Republican colleague, Senator Booker, a Democrat, and Senator Braun, a Republican in the Senate. There was a lot of support from them for the White House conference. And today we're talking to leaders on both sides of the aisle in Congress, and there's a lot of support for food as medicine. So I think this is a really exciting area. And thank you to Danny and Bernie and Food Tank for co-hosting this today with us with the White House. So a little bit of framing, and it's just important to step back, and many of you know these statistics, have heard me or others say them, but it's just so shocking how ill we are. It's incredibly shocking how ill we are as a nation, with much of it due to food. And most of it happening in my lifetime, in my adult lifetime. I graduated from college in 1991. We did not have an obesity and diabetes epidemic in this country in 1991. In my adult lifetime, this has happened. More U.S. adults are ill than are healthy. 1 in 2 adults have diabetes or prediabetes. 3 in 4 have overweight or obesity. And if you combine that with blood pressure and cholesterol levels, only 1 in 15 are metabolically healthy. This starts in kids, among teenagers. 1 in 4 teenagers have prediabetes. That's not okay. 1 in 4 have overweight or obesity. 1 in 6 have fatty liver disease. As a nation, we are failing nutrition. Out of 100, our average score on adherence to a healthy diet is a 58 out of 100. And this is true across age, sex, income, racial, ethnic groups. And it's worst at ages 5 to 18. We're failing the kids more than anyone else. Diet quality is worse among ages 5 to 18. And if you actually do careful quantitative analyses, this is unbelievable how much death and destruction this is causing. Poor nutrition directly kills 10,000 Americans every week. Directly causes 21,000 new cases of diabetes every week. This isn't the total cardiovascular disease burden or diabetes burden. This is that's directly attributable to poor nutrition, and 45% of all cardiometabolic deaths. My clicker is not always working. There we go. And there's a lot that goes beyond this. And I think COVID-19 is one of the reasons we're here, because this shined a light on how sick we are as a nation, with diabetes, hypertension, and obesity being the top risk factors for poor outcomes from COVID-19. And from our analysis, we've estimated that 750,000 people died that didn't have to die if we had good metabolic health. They would not have died. COVID would not have been as severe. And if you put together the healthcare costs and the lost productivity costs, just those two costs, it's estimated $1.1 trillion a year is being lost by our economy. $1.1 trillion. The current budget battle between the House and the Senate is about $100 billion a year. If we just took 10% of the healthcare costs of diet out of the healthcare system, we would pay for all of the budget battles. And now there's also an incredible positive here. There's a potential to lock business innovation. We have Secretary Dan Glickman here who talks about this all the time. The food sector, from ag to retailers to supermarkets to ag tech to restaurants, this is a major part of our economy. And we don't think about this as a major part of our economy. 1 in 10 jobs are directly supported by food and ag, let alone all the indirect support. It contributes to about $1 trillion in positive economic output. Exports, it's the #1 source of new jobs in small businesses in minority and ethnic communities are companies in the food sector. This is a source for economic empowerment for our minority communities. Consumers are now demanding healthier foods, which is a business opportunity, and there's a rapid growth of ESG investing, which is also a business opportunity. So how do we shift this 20th century food system that we have in the 21st century? We have a system that's been built not by industry setting out to make us sick and fool us all and addict us on food, but we have a food system that was built very specifically for goals of the 20th century. What were the two big goals of the 20th century? Getting vitamins to people, because that was the science of the 1930s and 1940s and 1950s, was vitamin deficiency diseases, which were very common in the United States, and getting calories to people, because the population was exploding from about 1.6 billion to 6 billion in the last century. So the main goals of the last century for food were vitamins and calories, and we were successful. We created monocropping of crops to be able to feed a massively growing population. We created highly processed, shelf-stable, vitamin-enriched foods, which have largely eliminated vitamin deficiency diseases. We created this food system consciously, and it met the goals and was successful for those goals of the 20th century. But now we have this 20th century food system with 21st century problems that I've just outlined. So this is a very simple roadmap. We've created the modern food system in about 50 years. We started working on this around 1960, 1970. We were done by 2000. It was a very conscious effort, and it happened very quickly. And how did it happen? It happened through a combination of, I have to click 2 or 3 times, sorry everyone. It happened through a combination of scientific advances, government action, and private sector innovation. This was the roadmap to create the modern food system that we have. Science was advancing in the last century around vitamins and calories and a population explosion. Government took notice and said we have to have policies and actions and investments like the Green Revolution in Mexico and India and Pakistan and elsewhere, and private sector innovation that drove the incredible successes of getting food and vitamins to people. This is the roadmap. And so we need to take the science we have now, work with government, and bring in the private sector, which also includes civil society and nonprofits and of course, all the advocacy organizations, and fix the food system. And I think we can do this in 10 or 20 years if we put our minds to it. So it's not simple. There's not one answer, but there's also not 1,000 things we need to do. There's about 30 or 40 things we could do to dramatically shift the food system in the United States. And these are kind of the domains of actions that we need to focus on. And this is from a task force report that we put out in advance of the White House conference. And much of this is reflected in the new national strategy. Now, food is medicine, I think, is particularly exciting because it finally brings healthcare into the conversation. This is almost $1 in $5 that we spend in our entire economy. $1 in $5 that goes through everybody's pockets goes to healthcare. And so we need to take that and leverage it for food as medicine. First, let's level set on what we're talking about. And I think today, actually, probably all of these definitions of food as medicine will be used. So I've heard food as medicine used in broad ways. There's no single definition that's out there. But these are sort of 3 broad ways that I hear food as medicine most commonly used. The first is just the very, very broad concept that food is foundational to health. If we want to think about health, we have to think about food. And people who use that definition almost don't even like the definition of food as medicine, the term, because they think it medicalizes food. And they almost prefer the term food as health. That's the very broad concept. The second, more specific concept is to think about food as medicine. So the hundreds of thousands of bioactive compounds that are in foods like cocoa and green tea and blueberries and coffee and many, many other natural plant compounds, these natural bioactive compounds, how can we identify them, leverage them, personalize them to treat disease? There's a whole world of science that's advancing this. But the third definition is the one that I typically mean when I use the term food as medicine. I think it's the one that's the most commonly used, is food-based nutrition interventions within healthcare system to treat or prevent disease. And I start with treat because very often when I talk to policy leaders or physicians or even members of the public, they say, yeah, we need to think about prevention, and an ounce of prevention is worth a pound of cure, and nutrition. All that's true, but here we're also talking about treatment of disease. We're talking about taking people with cancer, with diabetes, with heart disease, with hypertension, with heart failure, with significant diseases, and treating them with food. So it's not just prevention. I think there's two core concepts which make me think that food as medicine is so powerful and why I'm so excited about it. First, it addresses both food security and nutrition security. It addresses getting food to people who can't even know where their next meal is coming from, and making it nourishing food that helps their well-being and their body and soul. And so there's very few things that can address food and nutrition security jointly. And secondly, it's centered in health equity, and that's so important in healthcare. Whenever we have a new innovation in healthcare, a new drug, a new device, a new screening tool, who does it go to? It goes to the people that probably need it the least. And the people who need it the most vulnerable populations are left behind. This is seen again and again and again. And so healthcare innovations tend to widen health disparities, unfortunately. And here, we actually have a healthcare innovation that is directly targeting the most vulnerable populations among us and can actually improve health equity. So the way I think about food as medicine, this is a pyramid that we constructed with folks from the Harvard Law School, the Food as Medicine Coalition, and leaders at the Centers for Disease Control and Prevention. And so the way we think about this is a spectrum or a pyramid of interventions, with interventions at the top being for those patients who are extremely ill, all the way down to general population level healthy foods policies and programs. The three first bars are actual interventions that doctors can prescribe, or nurses can prescribe, or social workers can prescribe: medically tailored meals, medically tailored groceries, and produce prescription programs. Then there's using the federal nutrition programs like SNAP and WIC and school meals and meals for the elderly to advance nutrition security and food security linked to healthcare. And then finally, population level programs. We don't have time to go into all of these now, but I think in the discussion we will talk about all of these. These are really exciting innovations that are happening right now in healthcare. And the momentum is incredible. This is just a list that I came up with just in the last few weeks of just all the things that are going on just in the last year around food as medicine, from the White House conference to the national strategy, to the state Medicaid waivers now approved or pending in 9 states to test food in healthcare, to what's going on in Medicare, advantage organizations, private healthcare organizations like Kaiser and Geisinger and Elevance and others, the VA and Indian Health Service pilots, a potential Medicare pilot. I think we're going to see a bill drop soon in Congress about a Medicare pilot on produce prescriptions, the USDA GusNIP produce prescription program. There are leaders here in the room who originally got us FINI, like Orrin Hesterman, Michelle Nishan, others who've worked on this. This needs to be expanded. CDC programs. The FDA is talking about human nutrition and revamping its program. The accreditation organizations for residencies and medical schools are talking about making nutrition education finally required for doctors and other healthcare professionals. The NIH is going to be investing in this. Rockefeller and the AHA are investing in this. And there's many nonprofit and private sector implementers who are actually actively scaling up food as medicine. This is an incredibly exciting time. None of this was happening 5 years ago. It's incredible, and this is ramping up truly exponentially, and I think we're just at the very start. This is just a chart of the various Medicaid 1115 waivers, just to show you the red waivers that have been approved don't really have anything around nutrition. The yellow ones all have at least nutrition education and counseling and connections to federal nutrition programs. And the green are the more holistic, complete food as medicine programs. Incredible momentum happening here. Sorry, I think the clicker, sometimes I have to triple, quadruple click. Can someone forward for me in the control booth? Doesn't seem to be forwarding. Thank you. So we've just published, together with Hilary Seligman and colleagues, if you could go back, a no-print handbook on food as medicine for healthcare professionals. So if anyone is interested in that, I can send you the link. That went by quickly. And then also talking about new commitments, I'm going to be working with the university, and hopefully we're going to be able to make a formal commitment in August to the White House for a major new investment at Tufts in food as medicine to really create a cross-university initiative that brings together what's happening already in food as medicine across the several schools of the university, works with other hospitals in the Boston area and nationally, works with nonprofit partners, and really elevates food as medicine. Next slide. We'll go forward to that. Next slide, please. So I think this is a really exciting time. I'm going all in. This is going to be my full-time job to be leading this new food as medicine initiative now at Tufts. And so anyone who's interested in food as medicine and working with us and partnering with us, please get a hold of me. And thank you so much for being here.
Thank you so much. More applause for Dr. Mozaffarian, please. And a big congratulations to him on his new endeavor, which is so important. I always feel very inspired and hopeful after Dari talks, because that list of what's going on around food as medicine is so exciting. And I think, we're seeing so much momentum now, and that's more than I could ask for.